Hi everybody, my name is Bobby Geevarughese. I'm a licensed doctor of physical therapy. Welcome to my channel. So I decided to make this channel as a way to just teach people about my practice and how my practice can be different from traditional physical therapy practices. So my practice is focused more on treating the nervous system and focusing on a whole person approach. We still do traditional physical therapy care here. I have a telehealth practice, so I'm still seeing patients for post-op care, people who could be limited to staying at home, like parents or those with disabilities that can't get out. So we still do offer traditional care, but in treating chronic pain and other chronic health conditions, traditional care usually hasn't worked the best. And the research really does show that chronic pain and other chronic health conditions really take a whole person approach. We are not focusing more on structural and postural abnormalities and weakness and tightness. A lot of that has been disproven in the research as to that causing pain. We understand that fear of movement plays a significant role in making pain worse. If you go to traditional physical therapy, you would probably meet a therapist who would tell you that if something is painful, don't do it or avoid it. And what the research has shown over time is that really what you want to do is actually you want to engage in those types of activities and really participate in activities you could be avoiding. You can do it gradually, but what it teaches the nervous system is that if you avoid these activities, you learn that these activities are dangerous then. So if someone has difficulty with sitting for a long period of time, if we tell them don't sit for too long, that just reinforces the idea that sitting is dangerous. So we want to teach them actually that you can gradually get back to sitting longer times, but again, that the sitting itself is not the main issue. One thing in physical therapy that could be traditional is that you might be very focused on your symptoms, and we might teach people that. We might tell people to be aware of your symptoms throughout the day, when they wake up in the morning, and then when they're doing different activities throughout the day, whether they're standing, walking, sitting, doing household chores. We want them to be too aware of their pain. And what all of that only does, though, again, it reinforces the pain. It makes the nervous system very hypervigilant around your symptoms, which in the end, that just causes more pain, more anxiety, more fear, and then eventually it just will lead you to avoiding those activities. So we want to teach people to be aware of what's going on, but to get back to their daily life and daily activities. We can understand that pain will be there, but if everything has been ruled out medically, then it's okay to engage in the activities. And that's also important in this type of work, is that we want to make sure that everything structurally is ruled out. So if you have the ability to see a physician, another healthcare provider, even in physical therapy, we have direct access. I'm licensed in New York and New Jersey. And so even for physical therapy, we're allowed to see patients for 10 visits or 30 days without a prescription from a doctor. So we could even conduct an exam as well. And if there's anything that would be of more concern or just need further evaluation, we refer you out to a physician. So that's what I just wanted to teach as a start to what is different about this type of therapy that we're focused on, which is more aimed at the nervous system and the brain. It's also encompasses a lot of different factors, but I just wanted to kind of do this as an introduction. And going forward, I'm going to introduce more videos and teach more about different topics, different diagnoses, support with research as the research is available, and give you more information so you can make a best informed decision. Thank you very much.